Knock, knock. Come in. Hi, I'm Brianna. I'll be your nurse today. I'm just here on doing some privacy for you. Is it okay if I touch you?
Yes, ma'am.
Okay, can you just verify your name and date of birth for me?
Yes, Mackenzie Smith, 51005.
Okay, I'm just going to check this. So you're Miss Smith. Okay, Miss Smith. Are you taking any medications?
No, ma'am.
Are you allergic to anything that you know of?
No.
Alright, I'm going to verify some orders from the doctor. So the doctor has ordered us to do a neuro, musculoskeletal, cardiac, and respiratory assessment, and then also educate on some patient safety. Sound good?
Mm-hmm.
Alright, so I'm going to start with your face. So face looks symmetric, no abnormalities. Are you having any headaches?
No.
No? Okay. Let me get my pen light. Okay, I'm just going to assess your eyes. So real quick, are you having any blurred vision?
No.
Okay. So eyes look about a 5 millimeter. Okay, this light's just going to go in your eyes, okay? And just look straight ahead. Okay. And if you'll just follow the pin for me. Like that. Alright. So those are equal, round and reactive, responsive to light, and accommodating.
Hey, I gotta get something out there first.
Nose looks
I gotta get something out of
symmetrical.
the room out there.
Are you having any runny nose or anything?
No.
Okay. So we'll just hold this side for me and blow. Perfect. And hold the other side for me and blow. Alright. So no ringers or anything coming out. Can you just smile for me real fast? Okay. And if you'll open wide for me and stick your tongue out. Okay. No cavities. Gums look intact. Can you swallow for me real fast? Perfect. So trachea is no line of body. I'm just going to check your ears real fast. Are you having a hard time swallowing?
No.
Okay. Okay, and come this side, look. Okay, so ears are symmetrical, no redness. Have you had any ear infections recently? No, I didn't see any drainage or anything, so that's good. Do you know where you're at today?
Yes.
Okay, and can you state your full name for me?
Mackenzie Smith.
Okay, and where are you at?
I'm at the hospital.
Okay, and do you know who the current president is?
Yes.
Who's the current president?
Donald Trump.
All right. I'm just going to get you to stand up for me. We're just going to just do a little coma scale real fast. So you'll stand. I'm going to get you to close your eyes for me just for a few seconds. All right. You can open your eyes and sit back down. So everything looks good. No swaying or anything. So now, Mrs. Smith, I'm going to do a respiratory assessment on you, okay? Are you having any shortness of breath?
No.
No? Okay. I'm going to check, or let's do some different lung sounds, alright? I'm in her right upper lobe. Left upper lobe. Okay, and if you'll displace your breast for me. Left lower lobe. Okay, and if you'll take this hand to this shoulder for me real fast. And this is your left lower lobe. Okay. And we're going to come over here to your right middle lobe. Okay, and same thing, back hand to that shoulder. Right lower lobe. Okay, and I'm just going to listen to some on your back, okay? So right upper lobe, take deep breaths for me. Left upper lobe. Left lower lobe. Right lower lobe. Okay, so lung sounds, no adventitious lung sounds bilaterally, everything sounded clear. So I'm just going to educate you on this incentive spirometer real fast, okay? So this will be your incentive spirometer. I want you to inhale for 2 to 5 seconds and then exhale, okay? You'll do this 10 times every hour, or if it makes it easier, you do it during commercial breaks, okay? So I'm going to get you to demonstrate for me. If you'll take a deep breath. Perfect. All right. And can you just tell me what I just taught you about the incentive spirometer?
Yes. You want me to inhale for 2 to 5 seconds and then exhale. You want me to do it 10 times every hour.
Yes. Perfect. I'm going to take this for you and put it over here. And if you were a bedridden patient, Mrs. Smith, we would get you to cough and take a deep breath, and every 2 hours, and you would turn. So say that you would turn on your right side, you would cough, take a deep breath, Then 2 hours later, you would turn to your left side, cough, take a deep breath, and you would alternate that every 2 hours. Are you having any cough today?
No.
Okay, any mucus?
No.
No? Alright, so I'm going to move on to our cardiac assessment, okay? Any chest pain recently?
No.
Okay. I'm going to listen to your heart sounds really fast, okay? Your aortic valve, pulmonic valve, Erb's point, tricuspid valve, mitral valve. Okay, so S1 and S2 are present, and real fast while I'm doing this, I'm going to assess your apical pulse. So if you don't mind, just displacing your left breast for me. Okay, so apical pulse was 60 beats per minute, okay? So real fast, I'm gonna check for some capillary refills. You'll just stick your fingers out. Okay, capillary refills are less than 3 seconds, and I'm gonna just assess some different pulses really fast, okay? So your radial pulse. Regular +2, and I'm gonna do this in your other one. Regular +2, and I'm gonna come down here and do your posterior tibial. It's regular +2, and your dorsalis pedis on your left foot. Regular +2, and I'm gonna come in here and do the other side. Regular +2 on your posterior tibial on the right, and your right on the dorsalis pedis. Regular +2, and some different pulses I can assess is your carotid right here, your axillary up on your armpit, your brachial and the bend of your elbow, your femoral and your groin area, and also your popliteal behind your knees, okay? So now I'm gonna check for some edema. If you'll just put your hands out like this. Okay, hold it. We're doing your legs. And other leg. Okay, so no edema present today. So I'm just going to check for any jugular vein distension. So I'd have you sit at a 45-degree angle. Everything looks good there. Look on the other side. Perfect. So there's no JVD present. So now I'm going to do some range of motions with you for a musculoskeletal assessment. So if I could get you to put your arm out like this for me, okay? So I'm going to do her elbow joint. She's going to do flexion up, extension down. And if you'll do your hand like this, if you'll spread your fingers like this, it'd be abduction of the fingers, back together, adduction of the fingers. Perfect. And if I can get you to stand really fast. Okay. Now I'm going to get you to do abduction of your hip. So right here, here's her hip joint. And if you'll just go out, that's abduction, back in, adduction. And then also for your knee joint right here, if you'll flex up for me, perfect, and extension back down. Right, so range of motion was all good and normal. You can, well, first, I'm gonna get you to take some few steps for me, and on your way back, if you'll just do heel to toe, okay? Okay, balance looks good, Mrs. Smith. You can sit back down for me. Have you fallen recently?
No, ma'am.
No. Okay, so really fast, I'm just going to do some patient safety education, okay? So before you get up, just make sure the floor that is decluttered so we don't trip over anything. Make sure cords are put away so we don't trip over those. Make sure the lights are on so we can see when we're down cases, okay? Make sure you're ready to lay position and locked. And here's going to be your call light, Mrs. Smith. And here's your bedside table with your intended barometer. Is there anything that I can help you with?
No, thank you.
Alright, well, I'll put this into the doctor. He'll be in shortly. Just hand out you and put your privacy, okay?
Thank you.
Thank you.